in cuts due to the coronavirus pandemic. They say the 14% slash comes as some retail stores in Georgia begin reopening. Earlier this year, Governor Brian Kemp set a $28 billion revenue estimate for fiscal year 2020 that begins July 1. That, of course, was before the pandemic put that this wasn't a good investigation.
Guy, your thoughts about the overall investigation of Michael Flynn and what we learned or didn't learn this week about it?
I think a big question is why that interview took place at all. And if you read Kimberly Strassel's column in the Wall Street Journal, it is pretty devastating. I think it's totally possible to say he was railroaded and there was misconduct at the FBI. But also, to Marie's point, he did choose to lie to the vice president. He did have some very shady dealings, for example, with the government of Turkey. Maybe he shouldn't have been in that position in the first place, right? So you can maybe say perhaps he wasn't the best pick for a national security advisor. That doesn't mean there wasn't abuse. And I think some of the documents we saw this week point to abuse.
Well, we've got about 30 seconds. What are you most troubled by? Where do you see possible abuse?
Well, I think mostly it's the pretenses under which that interview was set up in the first place, right? Where they were basically saying, and Comey, the former FBI director, admitted this, he sent the agents there using sort of a chaotic new White House to sort of get this FBI investigation to come to the White House doorstep, and it just, the notes in the actual documents about saying trying to get him to lie, trying to get him fired, it doesn't smell great.
All right, panel, thank you. The smell test, and it doesn't pass it. We'll see you next Sunday.
Testing done, but there are definitely barriers there for people to obtain that, particularly if they have to find transportation or they don't have ready access to a healthcare provider. And we've also been surprised to find that we have not necessarily gotten negative test results reported to us. It's hard to come up with a good denominator so that we know the percent positive of tests we have. And so we have reached out to all the labs who report to us, but many of them are out of state, and it's just difficult to get all that information.
Dr. Khaldoun, let me ask the question sort of a slightly different. What are you seeing in your state that makes you uncomfortable advising the governor to begin even a partial phase 1 reopening?
Yeah, so here in the state of Michigan, we have over 43,000 cases and over 4,000 deaths. And so we are actually third in the country when it comes to states in the number of deaths. While we've seen certainly significant improvements over the past several weeks, our hospitals were over capacity, particularly in the southeast area of the state several weeks ago. We are still having parts of the state that are seeing an increase in the rate of rise of cases, and we know that their hospital capacity is not what it should be. We have to get our testing up, as I know people across the country are working on. So while we are cautiously optimistic, we still think we need to be very careful on a daily basis regionally. And so, again, we are still seeing, for example, on the western side of the state, that there are actually increases in the rate of rise of cases. We have several outbreaks there. We also know, again, in some of our rural areas, the number of hospital beds is actually not what it should be. And many of our hospitals in our rural areas are actually at capacity. So every part of the state is different. Even in Southeast, quite frankly, even though we're seeing a decrease in the rate of rise, we're still seeing many, many cases and many deaths every day. So we're going to be working on loosening or dialing up as far as how we're reopening the economy. The governor has actually already started that, but we really have to do it in an incremental, data-driven approach.
I imagine both of you are feeling pressure, whether it's pressure from friends and family tired of the quarantine, pressure from friends of yours who maybe run businesses, or full-on political pressure. Dr. Khaldoun, let me start with you. How have you handled it, and if you've been getting, how have you handled the public blowback, and how do you strike that balance in your own head where you feel like you're giving full-on medical advice versus, let me give you the best medical advice I can for the policy you want to implement?
So, this is certainly not personal. People hire me to give medical and public health advice, and that is what I do. I talk to the governor and other folks in the governor's office on a regular basis to tell them the facts. These are the number of tests that we are currently doing. This is where we want to be. This is what's going on with our hospitals. And again, if we don't do well with these social distancing measures, more people will die, and that is just the facts.
Room for ICU capacity, and
when you talk about contact tracing, there's a Hopkins study that says that we need 100,000 contact tracers. And when NPR did a study of all the states, 41 states responded and said we have about 7.6 thousand contact tracers, and we're looking to hire 36,000 more. So we're not there in terms of capacity, or it's a patchwork where some states are potentially doing it better than others. And so my fear, as it is with a lot of public health folks, is ensuring that states meet those capacities before they take the risk of putting particularly the vulnerable among our communities at risk. So nursing homes, prisons, minority communities.
Let me ask you the question this way. Over the last 2 months, in the medical community, have we learned enough, and with the news on remdesivir, how much capacity has that bought us? How much of an ability that we know there is some best practices that can lessen the time in the hospital or lessen the mortality rate? How comfortable are you getting that we're there where that can allow us to have some more reopening?
We're definitely in a better place than we were, in some ways. So one part is our testing capacity is better. If you looked at the numbers about a month ago, we were testing 10 people, 8 people to 10 people per 1,000, and we're now testing about 18 to 19, so that's better. Remdesivir is promising in the fact that it provides you with the proof of concept, as Dr. Fauci has said, that drugs like it or in itself could help reduce mortality, but we still need a whole other range of drugs, such as we need medications that if you're exposed, potentially keeps you from getting sick. So something called post-exposure prophylaxis. And then from what we know about this disease, we're learning that it's basically making the body uses the body's immune system to basically attack itself. The virus wreaks havoc, and then the rest of the stuff that happens to the body is the attack that you're doing on itself. And a lot of drugs, they're still in the works, haven't shown, are starting to show some promise, but we don't have a slam dunk in helping with that aspect of disease yet.
Let me move to the politics here.
And it didn't. It never happened.
Amy Walter, the New York Times is not satisfied with the vice president's answer. In fact, they write, Mr. Biden's word is insufficient to dispel the cloud, and the inventory should be strictly limited to information about Ms. Reed and conducted by an unbiased, apolitical panel put together by the DNC and chosen to foster as much trust in its findings as possible. So, Amy Walter, how much appetite is there in the Democratic Party to do something as extensive as the New York Times is outlining?
Chuck, and I think for a lot of Republicans and conservatives, the idea that the DNC is going to put together an unbiased panel to look through the documents of Joe Biden is kind of stretching it. Look, Chuck, we are in the place where we've been for so much of these last couple of years, especially in the light of this Me Too movement, about the fight not just over who to believe, but the fight over hypocrisy, and that's where a lot of this debate is being centered on. Democrats, including Joe Biden, but a lot of Democrats and liberals who held one standard for folks like Brett Kavanaugh and seem to be holding a different standard for Joe Biden. But this, Chuck, reminds me a little bit of the battle we saw in 2016, and quite frankly, we still see today with evangelicals and their support for Donald Trump, right? How can you support this person who's going against the standards you set for somebody else? And at the end of the day, this is what voters are left with. Not so much who they believe or don't believe, but how they battle this cognitive dissonance. And usually partisanship is what breaks the tie.
No, and Casey, on social media, basically it's the hypocrisy of the defenders of the party of Bill Clinton and the defenders of the party of Donald Trump, right? That's what every social media debate devolves into, is some sort of whataboutism on those two gentlemen.
Well, Chuck, I think also to Amy's point, Republicans are focusing on how Brett Kavanaugh was handled and how the media handled Brett Kavanaugh, how Democrats talked about Brett Kavanaugh. They're not talking about Donald Trump because the reality is that they can't, because the list of accusers that this president has is very long, and, each individual accusation has a different set of facts, a different set of claims. In the case of Joe Biden, there is one, and that claim is now being explored, and they are having to grapple with it. But you're right that, this debate has become very muddled and devolved into, lobbing charges back and forth. at the end of the day, I think Americans who care deeply about this issue and who care about women and harassment and changing that culture, at the end of the day, this is going to be a choice between Joe Biden and Donald Trump, and there are two separate sets of facts there, and voters are obviously going to be able to make up their own minds about that.
Yeah, I mean, Casey, I think without the piece of paper showing up, but I am curious. How many Democrats on Capitol Hill are empathetic, do you think, quietly,